And meanwhile, now we are working to find the optimized way of doing that inside a scanner for each individual patient. And to be able to do that, this is what we call closing the loop. What does it mean to close the loop? So you record frontoparietal engagement inside the scanner, right? You also stimulate that. How can we stimulate, record, and see how our stimulation is changing the recording, and then do optimize the stimulation based on that? And having an algorithm that can learn over the time what would be the best way of doing that inside the scanner. Okay? So that's a sort of a Bayesian algorithm that can learn with just doing different sort of try and errors inside the scanner to find what is the best way of engaging and making the highest level of connection. Because when people have highest level of connection, they can suppress their craving. They have further control on the craving that people can experience. And we have a specific target that is important for us, which is the frontoparietal target. And we have a specific optimization in terms of how to find the best way of connecting them together. And we called it closed loop electrical stimulation inside the scanner. This is a setting that we have been able to develop, putting all those pieces together, 2 other brilliant postdocs, Aki and Benny, and I mean, lots of technical challenges, but I mean, it is working now. And we have a technical report of that if you are interested to do that. And we have some initial result that seems that the system is working. So we ran the first trial with 10 participants in each group, and we showed that it is feasible, and we have done it in healthy people. We haven't done it in substance users, but we are planning to push that forward for substance use disorder as well. Okay, so being back to the algorithm that I showed you from FDA in terms of different COUs for biomarkers, different categories. So one missing category in this algorithm is targeting biomarker. So whatever that I was discussing during last 20 minutes, they are around targeting biomarker. And now we are recommending, just hopefully this week I'm going to submit that paper. We are recommending best working group to consider that as a new category in the field. And we have a specific definition for that. Any biomarker that can directly shape or guide or constrain the administration of a treatment, okay? And we are defining different levels of targeting biomarker. What we have been discussing today were mainly spatial targeting. But even for electrical stimulation, we also need to optimize the timing of the stimulation, the frequency of the stimulation, things like that. So these are temporal targeting and different sort of, and people in the field of cancer, they have molecular targeting. They target a specific molecule. So we are putting together that sort of framework, and we are hopefully submitting as a new category to the best algorithm. And we are thinking that there are going to be multiple targeting biomarkers in the field of addiction treatment, including one that we have been discussing in frontopolar cortex, and one we have been discussing the dorsolateral prefrontal cortex, and they are all interacting with nucleus accumbens and amygdala, and they shape a model for intervention. And what we are doing right now, we are developing sort of individualized framework that can do these targets in different individuals, and also exploring the best way of doing that in the frontopolar cortex, kind of, and some technical challenges I'm happy to discuss about some of those technical challenges. But it might be also interesting that we are also looking into some parietal nodes as well. So both dorsolateral prefrontal cortex node and sort of parietal nodes for a specific neuromodulation in the field. So if you are interested to learn more, we had a workshop. We put that on YouTube. So the videos of the workshop is on YouTube, so you can learn about this specific area. We had another workshop in OHPM meeting just a few weeks ago in Australia. That is also recorded. We will publish that as well, and that is going to be available.